Okay, Mr. Murillo, thank you so much for doing a testimonial for Chicago Arthritis. If I may please ask a few questions from you. If I may please get your full name.
Sure, my name is David Murrillo.
And then if I may ask please your age.
Sure, that would be 53 years young.
That is great.
Nice.
And then I just have a few questions for you. If I may ask,
Sure.
please, the first one would be, what was your life like before your procedure? What were you unable to do that made you upset?
So prior to Chicago Arthritis, life wasn't very nice. I have a condition called spondylolisthesis. So the short version is that my disc is starting to slip off my vertebrae. So that essentially happens in 4 different stages. I'm at stage 1. So it was hitting the nerve, which creates a lot of pain. So I started with naproxen, which is a muscle relaxant, and then after a certain amount of time between work and exercise, that no longer worked. And then sadly I had to upgrade to Vicodin, and that was working for a while, but it's kind of hard to manage with work and driving, which you're really not supposed to. So that went from Vicodin stopped working, and I went to Oxycontin. At that point I decided that enough is enough. So I went to the doctor, and they wanted me to see a surgeon. So I had a surgical consultation, and he recommended surgery, which I did not want to do. So upon my research, I found out about Chicago Arthritis and the stem cells that they offer. So I came in for consultation, and I'm on my 3rd session, and I definitely would not regret it. So I went from using medications, the pain level, we'll say from 0 to 10 was about a 8 or 9 with the meds, to after 2 procedures, here on my 3rd, it's down to about a 3 with no meds. So hopefully with this last procedure, I should be at a 0.
That's awesome. And can you tell us a little bit about how the procedures are like?
Oh, the procedures are great. The office, the staff is amazing. As for Jackie,
Thank you.
Right? And Dr. Tamber was amazing. I brought in my MRI, and he spent over 45 minutes with me. Actually, I brought in 2, one from about 5 years ago, and then one was current for the procedure. And we went over each line of the vertebrae, answered all of my questions, and he was amazing. He has very professional, excellent bedside manners, and I highly recommend Dr. Tamper and the facility as well.
Thank you so much. And then if you would just tell us a little final, what would you tell someone to consider Chicago Arthritis, the procedures that we perform here, please?
I would say the main thing, so surgery is always the last option, so it depends on your case. Some people actually require surgery, but if you catch it early enough, you could do the stem cells, which are great. I didn't want to go with, from my research, I didn't want to go with epidural injections, which is essentially a Band-Aid, which actually further deteriorates the region of the lower lumbar section, the L5S1, where mine was a slippage, whereas stem cell, which what they offer at Chicago Regenerative, actually heals all the ligaments and tendons and strengthens that area. So it depends, do you want to put a Band-Aid on something, or you want actual healing? That's primarily the difference. So there's a lot of copycats out there and companies that are claiming to do stem cells, but in the entire Chicagoland area, the only place I found was Chicago Arthritis that has legitimate research to back it up.
Thank you so much, Mr.
Sure,
Murillo.
absolutely.
I appreciate it.